Welcome again, everybody. This is J.D. Fascinetti with Pituitary World News, and we're here with Dr. Mario Maldonado from Recordati.
Hello.
Dr. Maldonado is a head of clinical development for global endocrinology.
Correct.
So welcome again to the video this time. I have to tell our audience that we just completed really a fascinating discussion on the new indications, and I wanted to take this time to ask you if there's a new indication for Isturisa that we talked about in the podcast, so everybody listen to that podcast. I wanted to ask you if there was a clinical study that led to or some observations that led you to believe to move with the right indication or to the new indication.
Correct. So the new indication is basically that Isturisa is indicated for the treatment of hypercortisolemia in patients with Cushing's syndrome, for whom surgery is not curative or not an indication or not indicated. Before it was just Cushing's disease, the pituitary form of Cushing's syndrome.
Yeah.
So basically, how the new indication came about, we knew from the mechanism of action of Isturisa inhibiting the production of cortisol by the adrenals that almost any form, or basically any form of endogenous Cushing's syndrome, it would work in. So it was through having conversations with the US FDA about what it would take to get the indication. And we had an observational, basically a retrospective, non-interventional study in France in patients with non-pituitary Cushing's. And we, through conversations, said, can we use this information? And not only that information, but basically the whole clinical development program of Isturisa in Cushing's syndrome, the Cushing's disease patients, a small study in Japan with non-pituitary Cushing. So all this were part of this. So once we completed the retrospective study, which again is a real world evidence, and we put together the whole package, and we went through writing the documents that need to be written for the supplementary new indication or new drug application. That's what ended up leading to the FDA concluding that this indication was warranted.
Yeah, interesting. You mentioned observation. Can you explain a little bit about how that works? That sounds so interesting.
Right. So basically, I for 20 years in clinical development, most of the studies we've done are what we call interventional studies. So we design a study and we tell the sites how exactly what they have to do for the patients, what is the dose of the medication they have to do, how frequent they have to measure, whatever needs to be measured for the primary efficacy, how to collect safety and all that. So the non-interventional studies or observational studies is that we just want to gather information on people who are receiving the drug, for example, Isturisa. And there's two types. There's the prospective, in other words, that we just, once they start the drug, we collect the information of the baseline characteristics and then the information during the time they are on the drug, so it's in the future, right? The retrospective is that they have already completed, or they have already started the patient, they have already been following them for X amount of time, and we just go back in time through their medical chart system and collect it in a very systematic way so that you can do this. So this is this is also known as real world evidence.
Yeah, so would you say it's, and the control is an important scientific word, but you have less control. It's the data, whatever it is there.
I mean, that's obviously there's advantages and disadvantages.
Yeah, of course.
The disadvantage is that you cannot really control what they're doing. Right?
Yes.
You cannot tell them, I want the urine-free cortisol measured every 2 weeks until we tell you when to stop. Yeah. But the advantage is that you can really see how clinical practice is done. For example, in our interventional studies, we tell what's the starting dose, how frequent to up titrate, and all that.
Yeah.
And as we know, not all patients require the same starting dose. And here we, in the observational part, we allow the physicians to use their clinical judgment to judge the status of the patient
Fascinating, yeah.
and decide, for example, what's the best starting dose and what is more indicated for them. We just observe what is the data. So there's a lot of data that can be, a lot of the advantages of actually developing this real-world evidence. That's really good for all.
Yeah, I can imagine. That's probably extremely important. So, well, thank you so much for your time.
Sure.
It's a
Thank
pleasure
you.
again to see you.
Same.